Good morning, everybody. This is Dr. Raul Rodriguez. Welcome to Edge Radio and my show, the Rodriguez Rejuvenation Show. I'm Dr. Raul Rodriguez, board certified cosmetic surgeon, the founder of Rodriguez Rejuvenation, which is a very unique cosmetic surgery practice that not only incorporates surgery like liposuction, Brazilian butt lift, things of that sort, breast augmentations, but also it includes things such as hormonal replacement, erectile function enhancement, female enhancement in other ways, and hormone replacement. Just things that make you feel younger from the inside out while I'm making you look younger from the outside in. So, as always, I have my lovely co-host, Miss Sierra Ross, here with me, and we're going to be talking about a subject today that's it's grown-up talk.
Oh, wow, interesting.
So if you have any children in the room, it's will be a sensitive conversation, but it's a straightforward conversation. This conversation needs to be had because, like always on the show, I like to talk about things that you're not going to hear about when you go visit your family doctor, your OB-GYN. They just don't have time to educate. They're too busy trying to stamp out disease. So with that said, there are things that we can do because as time goes on, and we talked about this, Sierra, on the show, things change as we get older, okay?
This is true.
And we talked about our skin changing, and there's things you can do to keep your skin tighter and younger and fresher looking. And I even made reference to when I was on stage a few years ago giving a presentation, and I talked about tightening. And we talked about a particular type of procedure, thermi-tightening, which is using radio frequency, which is a gentle controlled heat. And I talked about that we can use this technology to tighten up everything from your face, head down to your toes, and parts in between. So today we're going to be talking a little bit about the parts in between.
So, Doc, is it ever too late to improve your sexual health?
It is never too late to improve your sexual health. And when people come to my practice, you know, many people will find because they're looking for a certain procedure or treatment, but when you become a patient of mine, I educate you on lots of other things that you may not have had a clue about, things such as nutrition, lifestyle modifications, other things of that sort that are going to keep you healthy and keep you young and vibrant for the rest of your life. And that's kind of a unique approach that I have in my aesthetic practice, cosmetic surgery practice, because as I get older, you know, I've got a young wife and I've got two little ones, you know, and I'm a middle-aged man, and, you know, I've got to be around to keep up with them and to,
I'm sure you do.
and to raise my kids. So a lot of the things that I share with my patients when they become part of the practice are things that I do myself personally. You have a lot of doctors that talk the talk, but they don't walk the walk. They say, oh, you need to lose some weight. And the doctor's got a big old beer gut hanging out there, you know, because he hadn't seen a 30-minute walk in about 30 years. But I think it's important to let people know what they can do to take care of themselves. And it's especially important now with Corona and us being susceptible to illnesses that we never thought we'd have to deal with. There's things you can do to boost your immune system and keep your health up. So all that's incorporated when people come to me, let's say, for a Thermiva treatment.
Oh,
so
let's talk about it, Doc.
You may be wondering about that. Well, the Thermiva treatment, I talked to you about radio frequency. We discussed radio frequency before on the show, and many people are familiar with the fact that lasers have been used historically over the years to tighten skin, okay? And there's been issues associated with lasers because lasers are delivered in a brief blast of very intense heat energy and literally is delivered in thousandths of a second, called microseconds. And it's painful, and most lasers can't be used on skin of people of color because with lasers, you're causing a certain amount of trauma, damage to the skin, and then allowing the skin to rebuild itself and heal itself up in a way hopefully better than it was before, with less lines, less wrinkles, tighter pores, less sagging, etc. But in people of color, lasers of most wavelengths cannot be used safely to accomplish a lot of these things because you can end up with post-traumatic hyperpigmentation. That means darker areas in areas where you've had the trauma of the treatment that you were hoping was going to help you look better.
Is there any way to possibly have lighter spots when you finish? Like, you know how some people's skin look a little bleached?
With radio frequency, you don't. Radio frequency is like a first cousin of microwave, and the technology's been around a long time. I remember
Did you
when
say a first cousin microwave?
Yeah. Like the first cousin of microwave. It's kind of like microwave energy. So it's not a laser light, but it's a controlled electrical delivery of energy into tissues. And it's been around for, gosh, I remember when I started my practice, many years ago, back in the 90s, we had devices that we were using for cutting and making incisions in a less traumatic way and things like that. But only recently has that type of energy been used for aesthetic enhancement, to make tissues tighter, to make tissues younger looking, to make tissues more rejuvenated, as we're going to talk about it, because it's not just about tightening, and every part of your body. Now, obviously, most of the people who come to see me come because the most visible part of their body is their face. They want their faces to look pretty, they want their faces to look nice, and we can use this technology to help tighten the skin of the face, to help improve the quality of the skin. The way that heat energy, carefully delivered in a measured way, affects the body positively is that you're sending a signal to the body with carefully controlled heat. Whoa, you've been burned here. We need to make some new skin or some new tissue to replace what has been burned.
Gotcha.
And your body has that ability to do that at any age, as long as you're alive. If you cut yourself, it's going to heal. If you cut yourself at age 6, it'll heal faster than at age 60. But you still have that capacity. The human body has that capacity to repair itself when given the proper stimulus, the proper encouragement, so to speak. And that's what I do a lot in the practice. With the radio frequency energy, as with lasers, but we talked about lasers have other challenges and limitations, what we're doing is sending a heat signal to your body saying, hey, we need to make some new skin here where we got burned. But now we're able to do that without causing any burn. And without causing the thing that most people fear when they go to see the surgeon, pain. There you go. Pain. There you go. So with radio frequency, I deliver the heat in a gentle fashion. We gradually heat up the tissues, and we can heat up the tissues much more, thousands of times more than what you can do with a single little laser blast in a microsecond. We heat up the tissues for many minutes. And since we're heating the tissues gradually, it doesn't hurt. It's kind of like, I tell people, you ever seen anybody dive into a hot tub? Not unless they're drunk, okay? But people can gradually ease into a hot tub, and now they've got hot water up to their neck, and they feel just fine. Well, the water's just as hot, but you allow time for your body to adjust to it. The same way with radio frequency. We gradually heat up the area and get it to a target temperature that's high enough to signal to the body, hey, we need to make some new skin here. We need to make some new tissues here. But we do it without any pain.
Wow. How's the recovery time, Doc?
There is no recovery time. Since we haven't really burnt the tissues, like with lasers many times, there's nothing to recover from. When people have a procedure done, let's say on the face or the neck or the chest area, it looks kind of red and kind of like they've been out in the sun too long, and the redness goes away after several hours. You can apply makeup that evening if you want to, because your skin hasn't been broken. All that stimulation is taking place under the skin where the new collagen, that's the main protein in the skin, where the new collagen is being made.
Wow. Doc, this is very informative, and we do need to know how our body can rejuvenate itself.
Okay.
How does it work down there?
Okay. Well, the same principles that I just talked to you about that I apply to make people's faces look younger can be applied in the vaginal area. And the name of the procedure in my practice is called Thermiva. Thermi and then VA, like for the vaginal area. That procedure involves putting a little probe, it's a narrow probe, smaller than the size of the doctor's examining finger, inside the vagina and heating up the tissues all the way around on the inside. Now what that does is stimulates new collagen formation, tighter, more substantial tissues in that area where over the years or just from childbirth, things have gotten kind of loose or a little saggy or whatever, we can actually stimulate remodeling of the collagen in that area so things get tighter like they were in years gone by. And the nice thing about this is that when these studies were done several years ago, and I was one of the first doctors in the United States to adopt this technology, we got a lot of other benefits. The things that were trying to be accomplished were tightening of skin based on the principles I've just discussed with you. Mm-hmm. But when we applied to the vaginal area, what we found was that that gentle, controlled heat also rejuvenated the nerves. Mm. We've had patients that had never experienced orgasm. We're experiencing orgasm now because the nerves were rejuvenated. We had patients that have had painful intercourse. Now they can have enjoyable, pleasurable intercourse because the nerves are rejuvenated. The other thing we found is that also the glands of the area. And many women, for different reasons, may have low estrogen. They may have had breast cancer, which is very common. And many times with breast cancer, you put on anti-estrogen therapy. Mm-hmm. And when that happens, you end up with a condition called atrophic vaginitis. The walls of the vagina get thin, everything gets dry down there, and it's painful to have intercourse.
Now, Doc, would I notice the changes after I see you a lot? Would I physically know the changes or feel the changes without another party having to be involved?
All of my patients see the changes themselves without the parties being involved. When I talk about tightening the tissues, one of the other additional benefits besides just the nerves are rejuvenated in the area, so there's better sensation. Besides, the glands are rejuvenated, so now you have better lubrication, where before you didn't have lubrication because perhaps you didn't have estrogen or an anti-estrogen therapy. When the tissues are tight in that area, it also helps with mild urinary stress incontinence. That's a fancy medical term for a little pee leaking out when you cough or sneeze.
Okay, what is that?
Because the urethra, the little tube that drains the bladder, runs right over the top of the vagina. So when you strengthen those tissues and make them more substantial, now you're providing more support to that urethra, the little tube that drains the bladder, and you're less likely to have pee leak out when you cough or sneeze or bend over or exert yourself. I've had patients that have come to the practice and they come in just for that because they didn't want to have to wear adult diapers. I had one lady, a fairly well-to-do lady, on horses. She said she lost the joy of riding, and that's a very expensive hobby, by the way. She lost the joy of riding her horses because she would leak as she was bouncing on the saddle.
Wow.
And now I was able to restore the joy that she had and also be able to enjoy that very expensive hobby because she had multiple horses.
Oh.
Okay. So
is there something that a woman is particularly doing herself that can cause the lining to become thin?
Not really.
Just a natural.
It's a natural part of aging, number one.
Okay.
But then also things happen such as childbirth, which can stretch tissues in any particular area. As we know, we can stretch tissues on the inside, it can stretch tissues on the belly, leading to stretch marks. So childbirth can cause overstretching of tissues as well. But whatever the cause and whatever the condition, we can improve it. I'm not saying that we can cure everything, it's not a cure-all, but this can improve it because you have that ability to heal, the body has that ability to heal until you go in the grave.
Now, Doc, this just a little sidebar, but I know a lot of women possibly be asking this question. Can tampons play an effect on this?
No, tampons will not.
Okay.
Okay, and a lot of women think about tampons and things. Keep in mind, the female body is a remarkable organism. Well, men are just simpler. But thank women, bless her heart, thank God.
Shout out to the women.
Women are very complex, okay? Keep in mind, a big old head has to come through there. Mm-hmm. And a woman's body, when a woman's pregnant, there's certain hormonal changes that take place in their body. There's even certain things like something called elastin that's secreted that makes the joints more flexible, makes the joint in the symphysis pubis, that's down in the pubic bone, more flexible. So when you have a big old baby head that comes through there, you can deliver a baby safely vaginally. Okay? I've never seen a tampon as big as a baby's head. Okay? Now, Having said that, no, tampons really don't, unless you're just not using an applicator improperly and hurting yourself with the plastic and an applicator or something. No. Tampons will not lead to laxity in that area. Okay. Now, we talked about tightening on the inside, but guess what? Many years ago, when I first started doing cosmetic surgery, all we had to tighten things up down there was surgery. Okay. I could put a little speculum on the inside and open up and look inside and see, just like when the doctor's doing a pap smear. And then once everything's kind of opened up with a speculum, which is a little brace that holds things open so you can look inside. I could put some stitches in there and tighten things up with the stitch.
Wow.
And then I come out, and on the outside you can clip the lips on the outside and make them just the right size you want
sounds
it.
painful,
And then sew that up too. So you got a bunch of stitches down there. That's pain.
What's the new way, Doc?
That's recovery. The new way is now, imagine, Sierra, if we could tighten those tissues without stitches, without cutting, without surgery, so now there's nothing to recover from.
Tell us more.
Guess what? On the outside, we can also heat up the tissues on the outside, the labia majora and the labia minora, to get those tighter as well. So many women will say, well, I don't like the way that things look down there because it's, the lips are a little floppy or this and all that. We can help that even without surgery. Now, this is a series of treatments. Once again, we're allowing the body's natural repair mechanisms to kick in. And the protocol calls for 3 sessions, spaced out at least about a month apart, 4 to 6 weeks, because we do the first one, we allow time for the body to respond. It's like going to the gym. If you go work out, you allow time for your muscles to build up, to recover, and then you go back to the gym again before you get back to where you were before you started. So same thing applies to this. Anything where you're trying to enhance the human body, it takes time for the body to respond to the proper stimulus. Okay? So
Doc, I know a young lady that said that she wanted to try to use, I'm not sure if this is the proper terminology for it, but it's that freezer thing that you go into, that it's like really ice cold. And with it being ice cold, it's supposed to either rejuvenate your muscles. Would that would suffice for this particular procedure? Like, do you see what I'm saying to you? In a sense, I'm not sure.
That's called cryotherapy.
Thank you. Yes.
And cryotherapy doesn't tighten much of anything. Okay? Cryotherapy is designed to cool tissues, sometimes also relieve inflammation. Cryotherapy can be used sometimes with certain machines to try to freeze fat temporarily and destroy fat cells underneath the skin. So that's a non-surgical alternative to liposuction, although it's not as precise as the liposuction that we do at Rejuvenation. With that particular technology, there is no skin tightening. You can reduce the amount of fat in the area. The fat cells are killed and taken away, but the skin itself, there's really no tightening. That cold doesn't tighten the skin. Miss Sierra, if that worked and people have wrinkled up faces or wrinkled up parts down there, just put an ice bag on it. That's all you gotta do. You don't have to pay money to go sit in a fancy machine or the doctor's office. No. The ice itself doesn't help. And the people got lots of ice in the freezer. Okay, so no, that one doesn't work. But I'm glad you brought it up, because all these are things that people think about, and these are questions people have. They may want to ask, but they don't feel comfortable. So, that's kind of stupid. Well,
But if you don't know, you
don't know. You have to ask. So I always tell my patients, and the only stupid question is a question that you didn't ask. Okay? But there's a lot of misinformation out there, and that's why on this show I make it my point to be able to give people good, solid information that they're not going to get anyplace else. Okay?
Doc, you are amazing. Keep telling us about how
let me
to
tell you
tighten
about
up
that.
the
Remember,
lips.
you can always go to RodriguezRejuvenation.com. That's my website, RodriguezRejuvenation.com. And for the Thermiva procedure, look up, there's a drop-down menu, look up procedures, and you'll say Thermiva, and then there's a little icon there that says click here. You'll actually get to see before and after photographs, along with testimonials of real patients and what they were experiencing, what they noticed, etc., so that people can get very familiar with this type of technology and the Thermiva procedure at Rodriguez Rejuvenation.
Now, are these photos graphic to where I can really see the before and after?
The photos are graphic.
Okay.
Okay, so the little button, you have to look for the little button that says click here for testimonials. You know, we don't advertise it, but most of the people go to our website or adults, so we make you jump through a few hoops so that you can get to that, because obviously, you know, that's adult content. We're talking about adult content here on the show right now, and you know, there's adult content on the website as well. But people need to see that because it's all real.
Tell us the website again, Doc.
RodriguezRejuvenation.com, and look for the Thermiva, and that's Thermi, Thermi, and then VA. Okay, so that's
What's
good.
the phone number?
The phone number to call is 713-523-2500 to come to the office for evaluation, for treatment. So it's a great procedure. Now, I'd like to take a little time to talk about the guys. The guys are a little simpler, okay?
Very.
Now, when we're talking about male function, a lot of male function, you know, involves erectile function. That's enabled to be able to have an erection to satisfy your partner or to satisfy yourself. With that particular event, let me call it that, certain things have to occur for a good erection to take place. The main thing, in a nutshell, is good circulation, because there's a portion of the male member called the corpora cavernosa. That's the part that fills up with blood, and then like a balloon that you're blowing up, that's what causes the erection. And then afterwards, the blood leaves the area and you go back to a flaccid state, okay? Now, the problem with men and women as we all get older, our circulation just isn't what it used to be, okay? And this isn't an issue about shame or a psychological issue, it's a physiological issue. If you're not getting enough blood flow down there to little Willie, little Willie's not going to pop up
Some people have big willies,
it used to do. Some people used to have big willies. Now they got little willies.
I wasn't there for that. I don't know.
Yeah, well, trust me, I know. Okay, so if the circulation is poor, it's not going to be
Big Willie.
Big Willie. Okay.
It's true.
So a lot of what I do for male sexual rejuvenation is restoring good, healthy blood flow to the area. Well, one of the things that you can do without surgery, without treatments, a couple of things we do. You can always exercise. People don't like to exercise, but exercise increases your cardiac output, increases your blood flow, and the blood vessels all over the body, same blood vessels that get healthier around the heart to keep you from having a heart attack, they also help down there in the genital area to help have a little bit better blood flow in the penis.
And does that goes for women too?
Yeah, for women too.
Dang,
absolutely.
I gotta start exercising.
Okay. Now, well, we already talked about women. Let's give the guys a little love here. Okay. So, exercise also does something else. A regular exercise also helps to boost testosterone a little bit. And when men's testosterone levels are a little bit higher, and our testosterone levels begin to decline after about age 30 or so, and when the testosterone level can be boosted a little bit, you're going to have better erections as well. Okay? And there's supplements that you can take, but there's also hormone optimization, which I also do in the practice, which involves just putting a few little pellets up under your skin. You don't have to worry about getting hormone shots every week or painful that can cause knots in your butt or rubbing creams or other things like that, because those little hormone pellets, they call hormone pellets, are about the size of a long grain of rice. And for men, we put multiple little pellets under the skin. It's about a 10-minute procedure with just local anesthesia. The hormone is released gradually into your system over a period of many months. So we can restore a 50-year-old man's hormone levels to the level of a healthy 25, 30-year-old with a 10-minute procedure.
Just in 10 minutes.
10
Whole
minutes.
New person, 10 minutes.
That's all it takes. That's all it takes.
Guys, call Dr. Rodriguez.
Now, besides the hormone, getting the hormones right, getting your body fit, getting the heart pumping, increasing cardiac output, etc., there's some other things we can do locally in the area. And that's where the rod rock procedure comes in. Now,
I've heard about this procedure.
the rod rock procedure is a patented trademark name that I have for procedure that I do in the practice that incorporates injecting stem cells. Stem cells are the body cells that have the natural ability to repair tissues anywhere on the body, And we've been using stem cells in joints for arthritis to help restore the cartilage. It's been used in lots of different areas. I also use it on the face to help restore healthy, younger looking skin. So I can also inject stem cells into that corpora cavernosa where the circulation has gotten bad, and those little cells go to work right away, fixing up the plumbing.
Just like magic.
Just like magic. When the plumbing is better, the erection is going to be better.
And
the erectile functions improve, and everybody's better. Okay? So I also combine that in the rod lock procedure with pulsatile currents of energy and vibrations using special devices transmitted to the penis itself that also help stimulate the formation of new blood vessels. So I'm stimulating the formation of new blood vessels, putting stem cells in there so that it's making healthy blood vessels. The end result is little Willie now gets to be big Willie again.
And I'm sure all the Willies are happy.
All the Willies are happy, and all the Williettes
This is true.
are happy as well. So that's how it works for men. Like I said, we're much simpler. But in terms of men, maintaining overall health, we do some other things too, such as maintaining good body weight. Because when you exercise also, and I'd like to go back to exercise, you also decrease your body fat. And for men, we convert a lot of our testosterone that we have, which is declining every year. We combine that into estrogen and belly fat. So that also helps control the conversion of our diminishing amounts of testosterone into the chick hormone, estrogen.
Now, see, all this time I thought it had something to do with drinking beer.
That's a whole other topic for a whole different day. But it's mostly related to inactivity. There's lots of people who drink a lot of beer, but if you're active enough, it's not usually a big deal. Okay? So, as well as pizzas and hamburgers and things of that sort. But anyway, so that's just a brief overview of sexual rejuvenation, not sexual health. Everybody's talking about health. Dr. Rodriguez talks about rejuvenation. I don't want you to be healthy. I want you to be better like you were before, or better than you've ever been. Check me out at rodriguezjuvenation.com. If you want an appointment, call the office. The number is 713-523-2500. And also check us out on Facebook and on Instagram, Rodriguez Rejuvenation, both of those locations on social media. And you'll have a lot of before and after pictures. I'll have educational videos and be doing procedures and talking about a lot of things we talk about on the show, as well as other things we just don't have time to cover here on the show.
Well, they can also check you out every Wednesday here at 11 o'clock on Edge
right
Radio.
Right here on Edge Radio.
1540 and 101.7 FM.
Okay. As
so,
always.
Guys, Doc, is there any gems that you want to leave us with before we close out?
If things ain't right, you better come see me. That's for the guys.
Call them.
The gals, if things ain't right, you better come see me.
And tell them the number again.
Simple as that. 713-523-2500. That's RodriguezRejuvenation.com. And we're here for you.
All righty. Thank you, guys. And we'll see you next week.
This is Dr. Raul Rodriguez.
And this is your girl, Sierra. We want to invite you to join us every Wednesday at 11 a.m. for our new show, Rodriguez Rejuvenation.
I am a board-certified cosmetic surgeon, and each week we will discuss new breakthroughs in medical technology, erectile dysfunction, vaginal rejuvenation, natural breast augmentation with your own fat.
So you're saying that you can take the fat from my belly and increase my breast size?
Exactly, or your buttocks instead. Learn more at RodriguezRejuvenation.com.
Tune in every Wednesday at 11 a.m. on Edge Radio, where the truth still matters.
This is KGBC, Galveston, Houston, 1540 AM, and K269GS, Pasadena, 101.7 FM.
1540 AM and 101.7 FM Houston, Pasadena, Clear Lake, Galveston.
They say singing can